Hi, I'm Dr. Andre Sasson of Lighthouse Weight Loss, and it's my pleasure to share free education about GLPs. I'm sharing what I needed to know before I started taking them myself. In this video, I'm sharing tips for injecting GLPs. First, does it hurt? Not really. You'll be using the smallest possible syringe, an insulin syringe. Some diabetics inject themselves multiple times a day with this. The needle is so small that you might not actually feel it, or you might feel a small prick. I find that sometimes I feel a little prick, but it's generally painless. And after the initial prick, once I'm injecting the medication, generally doesn't hurt. That being said, it is normal to be apprehensive the first time you go to inject yourself. I mean, I can remember when I was first starting, it'd be like, okay, 1, 2, 3, 1, 2, 3. But once you get over that, once you inject yourself the first time, you see how relatively painless it is. It gets easy for most people. What can you do to make it even less painful? Well, you can have a friend or a family member inject you. You can ice the area first. You can distract yourself. Music's a good idea, but I'll tell you a trick I learned from emergency medicine, I'm an ER doc, is that listen to comedy. I've found that if I can make a patient laugh before a truly painful procedure, they tend not to mind it so much. Let's talk about injection sites. Personally, I prefer the area around my navel, or my belly button. Most of us have enough fat around our belly buttons to make this an easy site. Another option would be your thighs. Do rotate sites. Don't inject in the same place every week. Me, I just alternate left and right, above and below my belly button. Site preparation. First, you're going to use an alcohol wipe to wipe down the seal on your vial. Then you'll wipe down the area where you're going to inject. You're going to use a fresh new syringe every time. This is important to preserve the sterility of the medication. You're going to draw up the amount you're going to take. These have 100 units, so let's say 25 units. It's a tiny amount. If you're on a 2.5 milligram dose, you drop the 225 units. You inject the air into the syringe, equivalent to the dose you're going to take. Flip it upside down, draw up the amount you're going to take, let any bubbles out, pinch the skin, and go for it. I'm Dr. Sasson of Lighthouse Weight Loss, wishing you well on your weight loss and wellness journey.